So, hello everyone. Very good morning to all of you. So, welcome to this 1 hour session of oxygen hemoglobin dissociation curve. A very, very important topic in respiratory physiology. Every year in every exam, questions are repeatedly asked from this topic. It's a very small topic. If you understand the basics of respiration, definitely it will be a very useful topic and also an easy topic. So let's move on to the session. Opportunities are like sunrise. If you wait too long, then you will miss them. So don't miss them. I'm Dr. Abirami, your physiology faculty. So before learning about oxygen hemoglobin dissociation curve, you should understand some basic facts about how oxygen is transported in our body. So let's see how oxygen is handled by the body or it is transported by the body. So let's take, this is an alveoli and this is a blood vessel. So what is happening at the level of alveoli and the pulmonary capillaries? Exchange of gases. So how is this gas exchange? Let's look at this. Oxygen is taken into the pulmonary capillaries and carbon dioxide is given out. And carbon dioxide is expelled out through the lungs. Now look at this oxygen. As soon as oxygen enters into the pulmonary capillary, what does it bind to? Yes, you can also keep answering in the chat box so that it will be a two-way interactive session. Simple questions. What is happening to this oxygen once it enters into the pulmonary capillaries? Will it stay as such or will it bind to something? What is the change that is happening? Very good. Excellent, Dr. Paul Jason. Oxyhemoglobin. Very good. Anybody else? Does all the oxygen bind to hemoglobin? Or is hemoglobin is the only way for oxygen there? Yes, most of it is bound to hemoglobin. What is happening to the remaining oxygen? Yes, participants, please keep answering something. Only then, see, early morning, just trigger your minds. Simple questions. Just type something. It will make you active. How much is bound to hemoglobin? Out of 100%, how much do you think will bind to hemoglobin? Okay, very good. Dr. Prakalya says dissolved form. Very good. So you have two forms. So of these, this oxygen, nearly 97% of oxygen enters into the RBCs, the red blood cells. Inside the red blood cells, you have hemoglobin, nearly 97% of this oxygen binds to hemoglobin. So we find that hemoglobin is the major transport form of oxygen. 97% is bound to hemoglobin. What is the remaining 3%? What happens to this remaining 3%? It is not bound to hemoglobin. So what is happening to this? It is the unbound form. It remains dissolved in the plasma. It will not enter the RBCs to bind with hemoglobin. It stays back in the plasma. It is dissolved in the plasma. So it's called as dissolved form. So you have bound form, which is 97% bound to hemoglobin. Remaining 3% is dissolved form. It is not bound to hemoglobin. So what is the function of this dissolved form? Yes, now you can answer. The form which is bound to hemoglobin, it is a transport form. So it will be carried along with hemoglobin to every part of the body to give oxygen. Then what is the role of this dissolved form? Excellent, Dr. Paul. Partial pressures of oxygen. See, whenever we use the term partial pressures of oxygen, we say PO2, PO2. So what do you mean by partial pressure of any gas? If you have, so let's take this atmosphere. This atmosphere is made up of many gases. So what are the gases? 21% oxygen and 0.04% CO2, 79% nitrogen. All this is present in the atmosphere. So that contributes to atmospheric pressure. How much is atmospheric pressure? 760 millimeters of mercury. Out of this 760 millimeters of mercury, how much is contributed by oxygen? That is called as the partial pressure of oxygen. So how will you define partial pressure? In a group of gases, how much is the pressure contributed by that particular gas is called as its partial pressure. For example, let's take oxygen in the dry atmosphere. Out of the 760 millimeters of mercury, 21% is contributed by oxygen. So what is the partial pressure of oxygen? 21% of 760. This is equal to nearly 159 millimeters of mercury. So the partial pressure of oxygen in this atmosphere is, out of the 760, 159 millimeters of mercury is contributed by oxygen. That is called as its partial pressure. So that's why we use the term P. P means partial pressure of the gases. Yes, excellent, Dr. Prakalya. Very good. So this is just for you to understand what is partial pressure. So this partial pressure of the gas is contributed by the one which is not bound to hemoglobin. That accounts to totally of 3%, which is called as the dissolved form. So now let's do a small calculation to find out. We're just saying in percentage. We'll find out how much exactly is this dissolved form or the bound form. Okay, we'll do a calculation. First, let's do it for the dissolved form. How much is the partial pressure of oxygen in the arterial blood? Yes, keep answering. What is the answer for this question? How much is the PO2 of your arterial blood? If you take an ABG sample, very good, around 100. Okay, let's say around 97 to 100. So partial pressure in your blood or the arterial blood is 100 millimeters of mercury. So this you know. So the calculation goes like this. For every 1 millimeter of mercury is contributed by 0.03 ml of oxygen per 100 ml of blood. Every 1 millimeter of mercury, your partial pressure inside the arterial blood, is contributed by 0.003 ml of oxygen per 100 ml or per deciliter. Therefore, 100 millimeters of mercury is contributed by how much of this dissolved form? So simple, 100 into 0.003. So this will come up to 0.3 ml of oxygen per 100 ml of blood. So what is this value? So this is the total quantity of dissolved form that is present. So how did we do this? Every 1 millimeter of mercury contributed by 0.03 ml of oxygen. Therefore, your normal value of partial pressure of oxygen in the arterial blood is 100 millimeters of mercury. So therefore, 100 millimeter of mercury is contributed by how much of oxygen? So 100 into 0.003. So that will give you 0.3 ml of oxygen per 100 ml. So 0.3 ml is the total dissolved form of oxygen. So now you have calculated a quantity. Now let's do the same thing for the bound form. So let's calculate how much of oxygen is actually bound to hemoglobin. So how will you carry over that part? Yes, very good. For those of you who answered, very good. So let's do the other calculation. 1 gram of hemoglobin binds to, or 1 gram of hemoglobin can carry 1.34 ml of oxygen. 1 gram of hemoglobin can carry 1.34 ml of oxygen. Therefore, what is the normal hemoglobin concentration? Around 12 to 16. So let's keep an average value of 15. So therefore, 15 grams per deciliter of hemoglobin. Usually hemoglobin values are given in the form of deciliters. Therefore, 15 gram per deciliter of hemoglobin will bind to how much of oxygen? So how will you do this? 15 into 1.34. So that will give you 20.1 ml of oxygen per 100 ml of blood. Yes. So now we know how much is actually the dissolved form. 0.3 ml of oxygen per 100 ml of blood. How much is the bound form? 20.1 ml of oxygen per 100 ml of blood. So this 20.1 ml of oxygen is present in the arterial blood, and it is not actually 20.1. It is little lesser than that, around 19.8 ml of oxygen per 100 ml of blood. So why it is decreasing from 20.1 to 19.8? So what is happening there? Why it's not exactly 20.1? Because how much is the normal saturation of blood? Saturation of hemoglobin with oxygen? It is never exactly 100% saturated. You will understand that when we learn about the curve. Oxygen is never 100% saturated with hemoglobin, because normal adult hemoglobin is made up of alpha chains and beta chains. They have a good affinity for hemoglobin, but we have some mixing up of methemoglobin, sulf hemoglobin. So all this has no affinity to oxygen. So that is why it is not exactly 100, little lesser than that, around 97% saturation. So that's why even when you do an ABG, and if you check for with this oximeter, when you check for the saturation, it will never go up to 100. It will be around 97, 98, because we not only have adult hemoglobin, we also have methemoglobin and sulf hemoglobin, which will give you some mixing up, and it is never 100%. So that is why the value is never, if it is 100% saturated, you will get 20.1. But it is never 100% saturated. So that's why it is little lesser than that, around 19.8 ml of oxygen per 100 ml. So this is present in the arterial blood. So this blood flows into the tissues, and from tissues they drain into the veins. So in the venous blood, if you take a venous blood sample and check for the total quantity of oxygen there, this will be only up to 15.12 ml of oxygen, 15.2 ml of oxygen per 100 ml of blood. So what has happened to the remaining 19.8 minus 15.2? Yes, what has happened to the remaining blood, remaining oxygen? Can you think what is happening to the remaining oxygen? Yes, Dr. Hashwini, very good. 19.8 ml is present in your arterial blood. 15.2 is present in the venous blood. In between, what has happened to the 4.6 ml? 4.6 ml of oxygen. What has happened? Between the arterial side and the venous side, what do you have? Very good, Dr. Shiba. It has been diffused into the tissues. Tissues have extracted the remaining. So in arterial blood, 19.8. But when it comes to venous blood, 15.2. In between, you have the tissues. So tissues have extracted around 4.6 ml of oxygen per 100 ml of blood. So this basic calculation is very important to understand about oxygen hemoglobin dissociation curve. You should know how much is the dissolved form, and dissolved form only contributes to partial pressure. And how much is the normal partial pressure of arterial blood? Not exactly 100, little lesser than that. And maximum transport form of oxygen is with hemoglobin. And how much? 1 gram with 1.34, therefore 15 grams with 20.1 ml of oxygen per 100 ml. So with this basic knowledge, let's move on to the curve. Let's look at this curve. Oxygen hemoglobin dissociation curve. So any curve, when you interpret, you have to first look at the axis. So it has partial pressures of oxygen in millimeters of mercury along the x-axis, and percentage oxygen saturation of hemoglobin on y-axis. So what does that mean? Y-axis means how much of hemoglobin is saturated with oxygen. So that is called percentage of oxygen saturation of hemoglobin. And the curve is a sigmoid shaped curve. First, let's interpret a normal curve. Then we will learn about abnormal curves. So this is a normal curve. So look at the normal curve, the blue colored curve. Let's take some values from the curve. So these values have been asked in your exams. Okay, at least these three values you should remember from the normal curve. At a partial pressure of 100 millimeters of mercury. What is this 100 millimeter of mercury? Partial pressure of oxygen in your arterial blood. So at this value of 100 millimeters of mercury on x-axis, let's correlate on the y-axis with percentage saturation. So this comes up to 100% saturation. But as you know, we have some methemoglobin, sulfhemoglobin, they cannot bind to oxygen. So it is not exactly 100%, little lesser than that. So you can say when partial pressure of oxygen is 100 millimeters of mercury, hemoglobin is nearly 97% saturated with oxygen. Yes, okay. Now let's do another value. At a partial pressure of 60 millimeters of mercury, partial pressure on x-axis, 60 millimeters of mercury. See what is happening to saturation. Hemoglobin is 90% saturated with oxygen. So what does this tell you? Even though your partial pressure of oxygen falls from 100 to 60, saturation is not affected that much. It only falls from 97 to 90. So this is called as your safety factor. Safety factor. So what is a safety factor here? If there's any hypoxic environment, suddenly if you come across hypoxic environment, your partial pressure of oxygen may fall from 100 to 60, but body will be able to maintain a saturation of 90%. So that is called as the safety factor there. See, this has a very important application in COVID times. So what are we actually measuring in COVID patients? Symptomatic patients, we measure most importantly saturation. So why do we measure saturation? So that is because, so constantly when you keep measuring your saturation levels, so it is around 97%. And when your partial pressure of oxygen falls from 100 to 60, saturation will fall from 97 to 90. So this tells you that even though your partial pressure of oxygen is falling to 60 millimeters of mercury, body will be still able to maintain a saturation of 90%. So that is your power of safety factor. See, that's why in COVID patients, after this maybe 60 millimeters of mercury, if the partial pressure of oxygen falls, then there will be a sudden drop in percentage of hemoglobin saturation. So up to 60, it will be maintained, but after that, there will be a sudden fall. So you will not know when the patient will become symptomatic. Patient will be perfectly normal, but suddenly he will become symptomatic. He will develop breathlessness. So that is because up to 60 millimeter of mercury, you have the safety factor. After that, there's no safety factor. There's a sudden drop in saturation from 90 to 80 and 70, and it goes on like that. So you will not know when this will happen. That is why we keep monitoring the partial pressures of oxygen or the saturation of hemoglobin with oxygen, SpO2, that's called saturation. Very often we keep measuring that. So that's called the safety factor. Look at another value. At a partial pressure of oxygen, 27 millimeters of mercury, maybe around here. Look at the y-axis. So this corresponds to around 50% of saturation. So what does this tell you? When your partial pressure of oxygen is 27 millimeters of mercury, hemoglobin is 50% saturated with oxygen, and this is called as P50. So what is P50? The partial pressure of oxygen of 27 millimeters of mercury at which hemoglobin is 50% saturated with oxygen. This is called as P50. So these are some normal values which you should definitely remember. Other values we need not remember. At least these three values you should remember. So now let's move on to the abnormalities of this curve. This curve always cannot be like this. It can be shifted to the right or it can be shifted to the left. So let's see what is the shift in this curve. The right shift and the left shift. So now let me draw a right shift curve. The curve can be shifted to the right like this. So that is called as the right shift of the curve, or it could be shifted to the left like this. So this is called as the left shift of the curve. So how are we going to easily understand this concept of right shift or left shift of the curve? So when you say right shift, listen carefully. When you say right shift, R here, the right, R stands for release of oxygen to tissues. R for release of oxygen to tissues. And what does L stand for? L for tissues are left without oxygen. See, L for L. R for R, release of oxygen to tissue. So when you have a right shift of the curve, more oxygen is released into the tissues. So what happens to oxygen hemoglobin affinity in right shift? More oxygen is going to the tissues. So the affinity decreases. But in left shift of the curve, tissues are left without oxygen. So that means all of this oxygen is bound to hemoglobin. So in left shift of the curve, more hemoglobin oxygen affinity. That is why tissues are not getting oxygen. But in right shift of the curve, all oxygen is released to the tissues. So the affinity of hemoglobin oxygen is very less. So few other factors which cause right shift or left shift. See, when we say right shift, right means something right or something positive. So let's put all positive factors in the right shift. What are the positive factors? Increase in H plus, increase in CO2, increase in temperature, increase in 2,3-BPG. What is 2,3-BPG? It is a byproduct of glycolysis. It's a product of glycolysis, and this 2,3-BPG, it is affected by few hormones. So this is increased by growth hormone, androgens, thyroid hormones. So all these three can increase 2,3-BPG. So all this will also cause a right shift of the curve. So since it's right shift, we have placed all positive factors or increasing factors. So what is another factor which can cause right shift? The right shift means release of oxygen to tissues. So it means oxygen need, the tissues need more oxygen. So what are the other conditions where the tissues will need more oxygen? Yes, can you answer this? Few physiological conditions also. Excellent, Dr. Hashwini. Hypoxia. So hypoxia is one factor where tissues need more oxygen. Oxygen has to be released to the tissues. So in hypoxic conditions, excellent, Dr. Sharan Shaktivel. Exercise, one another factor. When you do exercise, tissues need more oxygen. So hypoxia and exercise are other two factors. Hypoxia, exercise. These are other two factors where the tissues really need more oxygen. So more oxygen is released to the tissues, therefore causing right shift of the curve. So all this can cause right shift of the curve. So what are the factors which will cause left shift of the curve? When you say left shift, it means something negative, right? So we'll put all negative factors, all decreasing factors. Decrease in H plus, decrease in CO2, decrease in temperature, decrease in 2,3 BPG. All this can cause a left shift of the curve. What are the other miscellaneous factors which can cause left shift of the curve? Fetal hemoglobin. Why fetal hemoglobin? Because fetal hemoglobin is made up of alpha chains and gamma chains. So that has more affinity to oxygen. So fetal hemoglobin will hold all the oxygen to the hemoglobin itself. The affinity is more. That's why the curve shifts to the left. Tissues are left without oxygen. So that is fetal hemoglobin. Stored blood. So usually in laboratories, we store blood using an agent called acid citrate dextrose. But this acid citrate dextrose has an ability to inhibit glycolysis. So what happens when you inhibit glycolysis? Yes, when glycolysis is inhibited, 2,3 BPG levels fall because 2,3 BPG is a product of glycolysis. So fall in 2,3 BPG. So when 2,3 BPG falls, yes, very good. All of you have answered. Very good. When 2,3 BPG levels fall, automatically the curve shifts towards the left. So fetal hemoglobin, left shift. Stored blood, it can cause left shift. Just think of this. If a patient is suffering from hypoxia and he is in need of blood transfusion, and you give this stored blood to the patient. Stored blood contains acid citrate dextrose, which will shift the curve to the left. So if you give this blood to a hypoxia patient, the patient is already suffering from hypoxia. If you give this blood, the hemoglobin will hold all the oxygen and still the tissues will be left without oxygen only. So you should not give a blood which is stored with acid citrate dextrose for hypoxic patients, because that is acid citrate dextrose is going to inhibit glycolysis, no 2,3 BPG, left shift of the curve, all hemoglobin is going to hold the oxygen, tissues are left without oxygen. Already the patient is in hypoxia. Moreover, you give this blood, tissues are left even more without oxygen. So it's very bad if you give this blood. So nowadays what they do, we started replacing this acid citrate dextrose by CPD, citrate phosphate dextrose, because citrate phosphate dextrose, it does not inhibit glycolysis and it does not decrease 2,3 BPG. So it is a good agent. If you give this blood to a hypoxic blood, it is not going to hold all the oxygen to hemoglobin. It is going to release the oxygen to the tissues, because 2,3 BPG levels are not going to fall here. If you use ACD, fall in 2,3 BPG, left shift. So don't give to hypoxic patients because already his tissues are suffering without oxygen. So replace ACD by citrate phosphate dextrose, which will not inhibit glycolysis. Therefore, it will not decrease 2,3 BPG levels. Therefore, it will cause a right shift and oxygen will be released to the tissues. So in a hypoxic patient, that is what is needed. His tissues need more oxygen. So better use CPD instead of ACD. So that is the importance of fetal hemoglobin and stored blood, which will also cause a left shift of the curve. So for even more better understanding of left shift and right shift, let's do a small calculation from this curve. Just look at the curve. I'm just giving you an example to have a better understanding of how is right shift and left shift. Let's take 27 millimeters of mercury. So what is this 27 millimeters of mercury? P50. So how much should be the saturation at 27 millimeters of mercury? Yes, guys, answer this. How much should be? See, so many of you are there in the group. Be active. Lazy guys, just type the answer. How much should be the saturation? Just a number. Just type a number. Oh, thank you so much, Esther, Shiba, Vishnu. Raksh, Ani, Fatima, Vignesh, very good. 50%. So very good, all of you. So at a partial pressure of oxygen, 27 millimeters of mercury in a normal curve, you will have 50% hemoglobin bound to oxygen. Clear? Okay. Now let's look at the right shift of the curve. For the same 27 millimeters of mercury oxygen, look at the saturation. It is only hemoglobin plus oxygen is only 30%. Actually, it should be 50%, but here only it is 30%. What has happened to the remaining 20%? It has been released to the tissues. Remaining has been released to the tissues. So that's why when you have a right shift of the curve, affinity for oxygen and hemoglobin decreases. From 50%, it becomes only 30%. So the remaining has been released to the tissues. Remaining oxygen goes to the tissues. So that gives you about the right shift of the curve where oxygen is released to the tissues. Now let's do the same thing for left shift of the curve. For the same 27 millimeters of mercury, which is your partial pressure of oxygen, look at this curve, the left shift curve. It is nearly 65% hemoglobin with oxygen. Normally, how much is the percentage saturation? At 27, it should be only 50% saturated with hemoglobin. But in left shift of the curve, it is nearly 65% bound to hemoglobin. Normally, only 50% bound, but here it is more. So the bound form becomes more. It becomes 65%. So if more is bound to hemoglobin, what will happen to the tissues? Tissues are poor. They are left without oxygen. So in right shift of the curve, affinity is less, more oxygen is released to the tissues. But in left shift of the curve, affinity is more, so tissues are left without oxygen. This is something which you should know from the curve. So these are the factors which cause right and left shift of the curves. So we have two effects here. Yes, what are the two effects? NAT board favorite question. What are the two effects in this curve? Yes, you know, don't feel lazy. Just type, at least type the first letters. Bohr effect. Very good, Dr. Prakalya. Very good. Bohr effect. One more. What is the one more effect? Very good. Pavitra, Kavita Raman, Fatima, Hashwini. Very good. Haldane effect. Bohr effect, Haldane effect. Repeatedly asked question in your NAT board. So what is Bohr effect and Haldane effect? See that we have a simple method for that also. Right shift, R for release of oxygen to tissues. R for Bohr effect. R for Bohr effect. R for right side shift of the curve. R for release of oxygen to tissues. R for Bohr effect. So what is Bohr effect? When you have increased levels of CO2, the affinity for oxygen hemoglobin is less. So more of this oxygen is released into the tissues. This is called Bohr effect. Or simply remember, right shift of the curve means Bohr effect. More oxygen is going to the tissues. What is Haldane effect? So on the left side, Haldane effect. L for left, L for tissues left without oxygen, L for Haldane effect. So what is Haldane effect? So when there is less of CO2, more of oxygen binds to hemoglobin, causing a left shift of the curve. Or simply remember, left shift of the curve is called as Haldane effect. So Bohr effect, right shift. Haldane effect, left shift. So these are the shifts in the curve. So to summarize this, oxygen hemoglobin dissociation curve. You have partial pressure of oxygen on x-axis and saturation. How much of oxygen is bound to hemoglobin on the y-axis. Few normal values that you should remember. Partial pressure of oxygen, 100 millimeters of mercury. Hemoglobin is 97% saturated with oxygen. When it falls to 60, Still, it is able to maintain 90% saturation, your safety factor. When it falls to 27, it becomes 50% saturated, which is called as P50 value. Abnormal curves, right shift, R for right, R for release of oxygen to tissues, R for Bohr effect. And when you say right, all positive factors, increasing factors, increase H plus, increase CO2, increase temperature, increase 2,3 BPG. Few other factors which cause right shift. Whenever the tissues need more oxygen, as in hypoxia, exercise, all this can cause a right shift. Left shift, tissues are left without oxygen, which means where is the oxygen? Bound to hemoglobin. So in left side, any factor which causes increased affinity of oxygen to hemoglobin, it will cause a left shift. So when we say left means something negative. So we'll put all decreasing factors. Decrease in H plus, decrease in CO2, decrease in temperature, decrease in 2,3 BPG, fetal hemoglobin, stored blood. All this can cause a left shift of the curve. So that is called as Haldane effect. So very, 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 very important topic. Repeatedly, every year, questions are asked from the topic. And for a completion, let's finish double Bohr effect. So what is this double Bohr effect? So in which part of the body does this double Bohr effect take place? Yes, definitely, Dr. Shantini. That's what we're going to discuss now. Can you think of the part or organ in the body where this can take place? Very good, all of you. Placenta. See what is happening at the level of placenta. So let's say this is the placenta. This is the fetal side. This is the mother side. How does the fetus breathe? It will release its CO2 into the mother. So CO2 goes like this. So what happens to CO2 on the fetal side? CO2 decreases because it is giving out CO2 into the mother. So what happens on the mother side of placenta? CO2 increases. So what do you think will be the shift on the left side? Yes, what is the shift on the left side? What is the shift on the fetal side? On the fetus side, CO2 is decreasing. So what should be the shift? Left shift. Very good. So on the fetal side, you will see left shift of the curve. But on the mother side of placenta, it is receiving more of CO2 from the baby. So there is more CO2. If you have more CO2, what should be the shift on the mother side? Very good. Excellent, all of you. Right shift. Placenta is a same organ or a single organ. But in placenta, on one side you have left shift, on the other side you have right shift. So it is in the opposite directions. This is called as double Bohr effect. Double Bohr effect. So what is double Bohr effect? When the fetus is breathing CO2 into the mother, on the fetal side, fall in CO2, left shift of the curve. But on the mother side of placenta, if you examine, there is more CO2, therefore right shift of the curve. So this left shift and right shift happening in the same organ, but in opposite directions, this is called as double Bohr effect. This is also another favorite concept of NAT board people. Yes. Okay. So hope you understood this concept. So if you have really understood this concept, please try to answer this question. So the question is, what will happen to the shift, right shift or a left shift when there is an decrease in pH of the blood? Decrease in pH. Think and answer. Will it cause a right shift or left shift? We did not talk about pH in the curve. So that's because it will confuse you. I didn't include that. Think and answer. When there is a fall in pH, will you have a right shift or left shift? Fall in pH means what? Acidity is increasing. Only then you'll have a fall in pH. Acidity means H plus is increasing. So when you have increase, yes, it's acidosis. So in acidosis, they can give you clinical conditions where the patient can have acidosis. What will be the shift in the curve? Excellent, all of you. Very good. So you understood this. So all of you have answered right shift. Very good. So whenever there is a fall in pH, acidosis, there is increased H plus. And what will increase H plus do? So when you have increased H plus, so this will cause a right shift of the curve. So keep in mind, in right shift of the curve, we will put all increasing factors except pH. Okay, so because whenever pH increases, or I mean, whenever H plus increases, there is a fall in pH. So that is why we don't include pH in this curve, because you get confused with that. So leave away pH. Otherwise, our concept applies. Right shift, all positive factors. Left shift, all negative factors. But keep one point in mind. When it comes to pH, it will be opposite. Right shift of the curve, increase H plus, acidosis. Therefore, fall in pH will cause right shift. And an increase in pH will cause left shift. So this is one exception where a fall in pH, right shift, increase in pH, left shift. Okay, please keep pH in mind. Don't confuse H plus, pH and acidosis all together. Don't get confused. Increase in H plus, therefore fall in pH, therefore right shift of the curve. So this completes our oxygen hemoglobin dissociation curve. So in case you have any doubts, you can ask. So otherwise, life is beautiful. We can finish with this. So have a wonderful day ahead. Thank you so much. So if we are done, you can leave the session. If you have any doubts, you can ask. Yes, thank you, all of you. Thank you. Thank you, Dr. Janaki, Shiba, Vignesh. Thank you. Pavitra. Yes, Dr. Vishnu, that will also cause a right shift of the curve, because tissues will need more oxygen there. Yes. Divya, Hashwini, Monisha. So very active, guys. Early morning, all of you are studying. Very good. Give it up. Thank you so much. We'll finish the session. Okay, Dr. Divya is asking for the first page. So this is the first page, Doctor. Please take it down if you have missed something. Yes, Dr. Divya, are you done? If you are done, we can finish the session. Yes, thank you.